our approach is different. You know, the time of high-risk groups is over, given the prevalence of the epidemic in this country. There's only a simple risk factor for being HIV positive. It's being sexually active. Doesn't really matter what your age is. Doesn't really matter how you do it. Doesn't matter who you do it with, whether you do it with your principal, your CEO, you know, a pastor, a pope, or a prostitute. It don't matter. It's not about your morals. It's about sexual activity. So anybody that's sexually active must understand that they are at risk. Whether you are a faithful, monogamous housewife, whether you are a bishop's wife that's only looking at the bishop, because it doesn't necessarily mean that the bishop is only looking at you. Now people have to understand this. What is it that you can control? You personally. That's not dependent on funding from overseas or the will of government. It's sticking to one partner. We're not saying don't be sexually active. But if you're going to be, stick to one partner. And make sure that that partner is only sticking to you. Yeah. It's not a one-way street. You can't sit as a housewife and say, you know, he brings the bread here and I'm faithful to him. That's enough. That's how you're going to get infected. You know, and people have to understand, the HIV virus is not a virulent virus. You work hard to get infected with HIV. And if you've worked hard, you must take responsibility for that behavior. Don't become a victim. I say to people, if you're sexually active, you fit into one of 3 V's. Either you are a vector, either you are a victim, or either you are a victor. And a vector is someone that blasé, gets involved in sex, doesn't know their status, is not practicing safe sex, and will sleep with anything that walks. That's a vector. Because the fact that you don't know does not mean you might not be transmitting the virus. And the victim is the one that says, oh, I needed a cell phone. Oh, I needed food. Oh, I don't have money for school fees. I needed clothes. You're turning yourself into a victim. Or the one that wants to get the grant, get infected so that you can get a grant. Or you can be a victor. Or you take responsibility. Or you stick to one partner. Where you know that the responsibility to protect yourself is with you. It does not lie with the next person. So if you are South African, you're going to engage in sex, know your status, know the status of the person you want to sleep with, test together with that person and take it from there. And if any one of you is positive, please use condoms. And people have to understand, what we've not done well in this country is to tell people that abstinence is 100% protective. If you stick to one partner and both of you are negative, it's 100% protective. But even if you are positive, discordant, or both of you are positive, the best thing you can do is to stick to one partner. Because you reduce chances of reinfection, you will live a normal life, you can be healthy. If you need to be on treatment, your viral load will go down, your infectivity will go down. But if one or both of you are positive, condoms are not an option, they should be mandatory. And what we forget to tell people is that condoms, under laboratory conditions, have a 20% failure rate. But when you mix them with drugs and alcohol, they're virtually useless.
Your thoughts on what